This is a type 1 intermittent cataract wherein you can see vacuoles in the underneath the anterior capsule. I put Blu-rays to the side port, the main port, and then I use a soft shell technique of viscoat and sodium hyaluronate and try to do the rexus with the cystitome. But as soon as I touch the rexus, because of the increased intralenticular pressure, you can see the rexus is extending in three areas, producing a typical Argentina flag sign. Immediately, I don't lose my calm. I use a micro scissors and convert one part of the rexus into a semicircular rexus, the another part also to a semicircular rexus. This is not a very hard cataract, about grade 2, and then I go in with my phaco probe, just make a small trench and then try to bring the nucleus up into the iris plane and try to do the vertical chop, a combination of vertical chop, making sure that I put viscoat now and then to protect the corneal endothelium, and then with the dual linear which is there on the stellaris, I aspirate emulsification of the nucleus, and every time you come out of the eye, inject visco so that the chamber does not shallow and the rexus does not extend. I use the coaxial irrigation aspiration to remove the cortex and the epinucleus, taking care not to aspirate the capsular flaps, again injecting visco when you come out of the eye. In this case, because the bag is not totally uh, intact, I'm putting a multi-piece or three-piece lens, an MA60 lens. I normally use what is called the drop-down technique of the trailing haptic. Use a McPherson and try to drop it down into the capsular bag underneath the capsular axis. In this case, I failed in that. So I'm just trying to dial that trailing haptic into the bag, making sure that you don't give much of a posterior pressure. Inferiorly, you can see some capsular remnant, which I'm again converting into a semicircular axis, removing the viscoelastic, then injecting myocol through the side port, making sure that the pupil is becoming small. And when I come out of the eye, I inject an air bubble into the anterior chamber, hydrate the main port and the side ports, and that's the end of the case, wherein you can see a pupil is round and the air bubble in the anterior chamber, the lens is well centered. Argentina flag sign, prevention is better than cure, but once it occurs, you need to follow these protocols and make sure you get an optimum result. Because this Argentina flag sign, the rexus can tear, can extend across the equator into the posterior capsule, and you can have a nucleus drop. Postoperatively, this patient had a clear cornea, round pupil, well-centered IOL in the bag, and had a vision of 6/9 on day 1.